tissue allows bacteria to flourish. So infection is a major problem in them. They already have compromised immunity. So, and with this vaso-occlusion, it's going to get worse. So, and they are particularly prone to pneumococcal infection. That's why we want to be sure that we start them on penicillin from the age of 6 months. Some people even say 4 months. And then we make sure they take their pneumococcal vaccines and other routine immunizations. If they are sensitive to or allergic to penicillin, you can give erythromycin. So we also need to manage complications when they occur. You have anemia, malaria. Here in Nigeria, we give them anti-malarial medications, some Progranil, but some people just choose not to take it and try to prevent the children from being bitten by mosquitoes. So you have to also prevent and manage stroke. I mentioned stroke. The good thing about stroke in sickle cell is that a lot of work has been done. And they found that those who are on that hydroxyurea I mentioned, they are less likely to have stroke. Apart from that, those who have had stroke and you do transfusion every month for them, it prevents secondary stroke. Then we have what we call transcranial Doppler that we do. We do this for children between 2 and 16 years because that's the peak age where you can have them developing stroke. So this transcranial Doppler, they just use a Doppler through the temporal area. Sometimes you use the suborbital, suboccipital, submandibular areas to check for the arteries in the brain and check the velocity. So usually if the velocity is high, that will suggest that there is blockage about to happen in the brain. So it's a very good predictor of primary stroke. So if the velocity is less than 170, you say it's fine. If it's between 170 and 199, you say it's conditional. That means anything can happen. So if it's fine, you do it once a year. But if it's conditional, that's between 170 and 199, you are going to do it after 3 to 6 months. You keep repeating it until it's normal. But you make sure they're on hydroxyurea if it's conditional. But if it's above 200, then that is abnormal. So such a person will need exchange blood transfusion and then monthly continuous transfusions. Of course, you know the issues with transfusions also. And we have priapism as a problem.